Hello, everyone. We'll just give it a second for everyone to get out of the waiting room. We're getting some attendees, so we'll just give it one more second. Great. Okay, it seems like the waiting room is trickled down a little bit. So, good afternoon, everyone. Welcome. My name is Sharon Smith. I am with the California Department of Insurance, the Community Relations and Outreach Branch. I'll be moderating today's session. Thank you for joining us for understanding your health insurance rights, coverage, care, and consumer protection in California. Over the next hour, we're going to walk through what your rights are as a health insurance consumer in this state, how to spot and avoid common insurance scams, and where to turn when you need help. So without further ado, let's get started.
Muy
Next
buenas
slide.
tardes a todos. Interpreter speaking here. Just to clarify, would that be simultaneous interpretation or it'll be consecutive interpretation?
Simultaneous. I'm going to move you into the room now. We have Spanish interpretation in our interpretation room. So we'll move you in
Alrighty,
now.
thank you.
Thank you. So that room is now available for anyone who needs Spanish interpretation. And so you can go on now, Sharon. Thank you.
Thank you. You can go ahead and go to the next slide. So before we dive in, just wanted to give a few housekeeping notes. So the recording for this, the audio, video, and chat will all be monitored, and a recording of this webinar will be made available along with the slides. And our Health Equity Office also came out with a really amazing handout with a lot of great resources and links as it pertains to health insurance rights. So all of that's going to be sent to your emails at the end of this webinar. We are having all cameras and audio visuals off just to make sure this is a safe and comfortable space for everyone. By default, all attendees will be muted and video will be disabled. Video is going to be turned on just for our speakers. And for this one, we are not having a live Q&A during the session, but please stick around to the very end and we'll tell you exactly how to get your questions answered and how to contact our department. And again, just a reminder that there is Spanish interpretation available. It should be popping up at the end, at the bottom of your screen under more. And if you click interpretation, there's a live interpreter that is there. So thank you. Next slide. So here is what we have planned today. We'll start off with your health insurance rights in California, presented by the Health Equity and Access Office. Then we'll move into medical insurance fraud and scams from our Community Relations and Outreach Branch. And then we're going to close it off with the Consumer Services Division on how to get help from our department. Next slide. So to kick things off, I am pleased to introduce our first presenters from CDI's Health Equity and Access Office. Sesha Hodges is the Assistant Chief Counsel at the California Department of Insurance and Chief of the department's Health Equity and Access Office. Before joining CDI in 2008, she worked as an attorney at the California Department of Social Services and in private practice. She's joined by Gabrielle Lessard, an attorney in CDI's Health Equity Office as well. Before joining CDI last year, Gabrielle worked as an advocate, an author, and educator focused on immigrant access to healthcare. So session, Gabrielle, the floor is yours.
Thank you. Good afternoon, and thank you for your interest in today's webinar. I will be giving a basic overview of regulation of health insurance in California, as well as the department's Health Equity and Access Office. And then my colleague, Gabrielle, will step in to give some information about health insurance rights. I want to note that health insurance regulation is very complicated, and this presentation will include a basic framework of health insurance in California. However, I don't expect you to remember everything said here today, but the one thing to remember is that if you have questions about your health coverage or don't know where to go for help, can always reach out to the Department of Insurance's consumer hotline at 1-800-927-HELP, and our staff can help you or direct you to where you need to go. At the end of our portion of the presentation, we will provide the department's information as well as additional resources where you can go to get help. Next slide, please. Welcome to the world of health coverage. So as you can see from this slide, there are a variety of state and federal entities that regulate and or administer comprehensive health coverage programs in California. I will note that this is not a complete list. We tried to include some of the most common programs in California, and I'll speak about Medicare later. First off, we have the California Department of Insurance, or CDI, which regulates health insurers that sell coverage on the commercial market. Generally, CDI regulates insurers who offer preferred provider organization, or PPO coverage, which will cover you to see any in-network doctor but may require you to pay more to see doctors who are not in their network. We also regulate exclusive provider organizations, or EPOs, which cover you only for in-network providers and some less common kinds of insurance. This is coverage that can be bought through insurers on the individual, student health, small employer, or large employer markets. The department does note that the department does not have authority to approve or disapprove health insurance rates. Another California regulator is the Department of Managed Healthcare, which is also called DMHC. DMHC regulates healthcare service plans, which include health maintenance organizations in California, such as Kaiser, as well as some EPOs and PPOs. This is coverage that can also be bought on the individual, small employer, or large employer markets. Another entity in the California healthcare space is Covered California. Covered California is a marketplace to purchase coverage and where individuals who meet income and other eligibility requirements can receive subsidies to help pay for insurance coverage, as well as cost sharing. Covered California doesn't regulate its marketplace carriers. Instead, most Covered California carriers are regulated by the Department of Managed Healthcare. And for employer coverage, employers can actually self-fund their coverage, where they take on the financial risk of medical claims directly, instead of buying insurance for their employees. The self-funded plans are often administered by insurers, but CDI does not regulate the coverage. Instead, self-funded policies are generally regulated by the federal government through the Department of Labor. In addition, there is the California Department of Healthcare Services, which administers California's Medicaid and children's health insurance programs. In California, these programs are collectively called Medi-Cal. Medi-Cal is a public program that provides free or low-cost coverage for people that meet specific income and eligibility requirements. Next slide, please. Another public program for health coverage in California is Medicare, which is coverage for individuals 65 or older and those under 65 with certain disabilities, including end-stage renal disease. As a general rule, Medicare is regulated by the Federal Centers for Medicare and Medicaid Services, or CMS. Medicare's Part A, B, and D are run by the federal government. For costs associated with Parts A and B, individuals can purchase a private Medicare supplement policy, which is also called Medigap. Medigap helps pay for cost sharing. Medicare supplement policies are standardized across all but a handful of states. For Medicare supplement or Medigap policies, there are no networks associated with these policies, so a person can go to any provider that accepts Medicare. An alternative to Medicare Parts A and B is Medicare Part C, which you probably know as Medicare Advantage. Carriers who participate in Medicare Advantage are licensed with either DMHC or CDI, but the benefits in the plan are otherwise regulated by the federal government, specifically CMS. You cannot enroll in a Medicare supplement policy if you have a Medicare Advantage plan. Although Medicare Advantage plans are generally less expensive than Medicare supplement policies, participants are generally only covered if they go into an in-network healthcare provider. Next slide, please. For my final part of the presentation, before I pass it over to Gabrielle, I want to talk about my organization, the Health Equity and Access Office, or HEAO. HEAO was created on April 1st, 2021 by Commissioner Lara. Our role is to develop, review, analyze, and implement policy positions on health insurance issues, including expanding access to care with a focus on historically disadvantaged communities. We work with different branches across the Department of Insurance, but we are situated within the policy and legislative branch of the Department of Insurance. Given our location in the policy and legislation branch, we work in coordination with the department's legislative office. And a major way we help promote equity and access is through the legislative process. We have worked on drafting department-sponsored legislation with a focus on promoting equitable access to care. Through this work, we brief legislative staffers, testify, and provide subject matter expertise at hearings and meet with stakeholders, including consumer advocates, healthcare provider organizations, and insured trade groups on our legislation. In addition, we review health insurance legislation that isn't sponsored by the department and meet with stakeholders and provide assistance on technical issues. Once legislation becomes a law, we work on its implementation, including by drafting regulations and guidance, promoting health equity and access's policy goals within the Department of Insurance. In addition, we work with state, federal, and national stakeholders to promote CDI's policy goals. As I mentioned previously, one of our missions is to advance health policies that increase health equity and access, and we feel that it is inherent that we educate consumers on their rights. Therefore, I'm going to pass this on to Gabrielle, who will discuss some of your rights as a consumer in California if you're buying coverage regulated by the Department of Insurance. Gabrielle, please take it away.
Next slide, please. Hello, everybody. Thank you for joining today. I'm going to be talking about some of the health insurance policies that are of concern to you as a person who is insured. We don't have time today to go through people who are uninsured, and just as Desha said, we have limited time today, so it'll seem like I'm jumping around a little bit because we're trying to cover a lot of complicated information in a short amount of time. Now, you may have heard in news stories about people buying healthcare plans and discovering that the plans did not provide comprehensive coverage. One of the recurring themes in my presentation, sorry, Alan, I will slow down, is that California law can be and is more protective of consumers than federal law in the healthcare arena. So in terms of the scope of coverage that's provided by your plan, this is a case where California can provide protections that are above and beyond those that are provided under federal law. So California law protects insured consumers' right to receive preventive care at no cost. And that includes vaccines, cancer screening, your annual checkups, as well as pre-exposure prophylaxis, which is a particular medication that is available to prevent HIV for people who are at risk. And then in terms of the other services, and these services may require a copay, every insurance plan will cover core services, which include hospital care, mental health and substance abuse disorder services, prescription drug coverage, depending on your plan, and maternity care. And then there are more or fewer services available, again, depending on your individual plan. And if you get your coverage through an insurer, that may actually depend upon the size of the number of people who are working for your insurer and covered, spreading out that risk. And then again, these services can have cost sharing, unlike the preventive care services. And these are California rights, and they are not affected by the court challenges you may have heard about under the federal healthcare law. Next slide. Now, California law requires timely access to healthcare services, and that is a matter of both timing and your physical ability to access the service. So, for people who have state regulated insurance plans, so that does not include Medicare, those plans are required to provide all medically necessary care on a timely basis. So for access to appointments, for non-urgent primary care appointments, you need to get access to that care within 10 business days. For non-urgent specialty care, which is a little bit harder to access because there are fewer providers who do it, the law requires that care be provided within 15, your appointment be available within 15 business days. And then, as I said before, the appointment doesn't help you if you don't have the ability to get to it. So there are also time and distance limitations that require access to care within 30 minutes of travel time or 15 miles for primary and mental health care services, which includes treatment for substance use disorder, for alcohol, medications, or other kinds of substances. And then again, for specialists, it's a little harder to access them. So the law requires that they be available within 60 minutes of travel time or 30 miles. If you need emergency care, these time and distance limitations do not apply. You go immediately to the emergency room. Your health is more important than these regulations, and you need to go get the care that you need on an immediate basis. Now, one thing where that's not widely known, I think, at least wasn't to me before I started working for the department, is that if there is no in-network provider available, either there's no person available who provides the specialty care you require, for example, or they are not available within those time and distance limitations, then your insurer is actually required to arrange for out-of-network care at the in-network cost. So care with an out-of-network provider. But this is a situation where you're going to need to advocate for yourself. So you need to tell your insurer that you know your rights, and actually request that they provide you with access to that care. And if you have any difficulty receiving that care, or even the care that I described above, through your insurer, that's one area where our department can help you. And there's information at the end of my presentation about how to contact the Department of Insurance. We also have a handout with that information. And we can help you advocate with your insurer to get the care that you need. Next slide. So, non-discrimination. Non-discrimination is an important California value. We are a diverse state. We understand that discrimination exists, unfortunately, but protecting people against unfair discrimination is one of the things that's really an important function for our department, and I think for all departments within the state. So California actually prohibits discrimination on a number of different bases, and these are not affected by any federal government rollbacks of non-discrimination protections that you may have heard about. These rollbacks do not apply in California. So our laws prohibit discrimination on the basis of health status, and that includes any disability or perceived disability, your race, religion, genetics, as well as your national origin, and that includes protections based on your primary language, as well as sex. And protections against discrimination on the basis of sex include protections against discrimination on the basis of your reproductive capacity, your sexual orientation, and your gender identity. So an example of protection against discrimination on the basis of sex is that the law includes protection of access to gender-affirming care. and abortion care and reproductive services such as contraceptives and maternity care, even if those protections may have been rolled back or made less available because of changes in the federal law. Next slide. Okay, one of the things that I wanted to talk about is that we really, when we talk about non-discrimination, we need to distinguish between equality, where everybody gets the same thing regardless of whether they need it or what's right for them, and equity, where everybody gets what they need, understanding their particular barriers, circumstances, and conditions. And we really emphasize equity, even if it means that some people get something that isn't needed by the entire population, like maternity care, for example. The slide illustrates disability access, or access for people who have disabilities in the physical environment. One of the things that we have in California that really helps everyone is that we have these curb cuts or ramps on our sidewalks. And those help not only people who are using a wheelchair or other kind of wheeled assisted device, but people like me who are pulling around a wheeled piece of luggage, as well as people who might be pushing a baby carriage or a grocery cart. So a fundamental equity for everyone benefits our entire community, and it really is an important California value. Next slide. So one example of where fundamental equity requires something that may not be needed by everybody is language assistance. So our laws against discrimination include laws against discrimination on the basis of a person's primary language. So our laws against discrimination include a legal right to have free interpreters, people who do oral interpretation in another language, as well as translated written documents for people who have limited English proficiency, regardless of where they were born. And this is an issue that's important to me personally. My father was born in the United States, but spoke French as his first language. He learned English in the Army. Another kind of language assistance that protects against discrimination is a right for people who have hearing challenges to receive assistance to free sign language interpretation assistance, which is a protection against disability discrimination. It's important for everyone to understand that asking for interpreters or translation assistance is exercising your legal right. It's not expecting special treatment, even though it's not something that everybody requires. It's also not something that's unusual. Nearly 18% of us Californians have limited English proficiency. So, the person who needs to request an interpreter in this webinar or when they are looking for healthcare services, they're not alone. A lot of us benefit from the availability of this assistance. And again, on my last slide and on the handout, we'll talk about how you can get in touch with our department if your right to language assistance is denied or limited. Next slide, please. Okay, so again, our department, the Department of Insurance, or CDI, can help with many health insurance issues, and that includes denials of insurance claims, delays in receiving coverage for which you are insured, language access, like I just talked about, and problems with your insurance billing, such as bills that you receive that you did not expect or that you think you should not have had to pay for. And you can get assistance through our department either by calling the consumer hotline at the number that's shown or by contacting us online through the California Department of Insurance. Stesha talked about Medicare, which again is primarily a federal program, so it's not something that we assist with at the state level. There is a program called HICAP, the Health Insurance Counseling and Assistance Program, that is available to help you with Medicare. And then with all kinds of insurance, there is a nonprofit organization called the Health Consumer Alliance, which can help you with Covered California issues, any kind of private insurance issues, including managed care, as well as the individual insurance that our department regulates. So at this point, I will hand it back to Sharon to pass it to the next presenter. Thank you, everybody.
Thank you so much, Stesha and Gabrielle. That was a really excellent overview. I feel like I really learned a lot. I did not know about this timely access to care, so that was amazing. Now that we kind of understand what protections exist, I want to switch gears and talk about how to protect yourself from those that are looking to exploit gaps in that system. So I'd like to introduce Judith Pina, an outreach analyst at CDI's Community Relations and Outreach Branch. Since joining CDI in 2022, Judy has worked to connect California residents, local governments, community organizations, and other stakeholders with insurance information and consumer protection resources like she's going to do today. So Judy, over to you.
All right. Thank you, Sharon, for that lovely introduction. Hello, everyone. My name is Judith Pina, and I am an outreach analyst with the California Department of Insurance. You just heard important information about your health insurance rights in California. I'm going to build on that information by briefly discussing medical insurance fraud and scams. So we'll review some common scams, warning signs to watch for, and simple steps that you can take to protect yourself and your personal information. Next slide, please. Okay, so before we discuss specific scams, I want to briefly explain the role of the California Department of Insurance. One important thing to know is that we do not sell insurance. We get that question often. Instead, the California Department of Insurance oversees insurance companies and the agents and brokers who sell insurance in California. The California Department of Insurance helps protect consumers from insurance fraud and fraudulent health coverage by investigating and prosecuting insurance fraud. Some examples include fake or unlicensed health plans being sold to consumers. A person may think that they purchased a comprehensive health insurance only to find out later that the plan provides very limited coverage or no real coverage at all. So we also investigate billing fraud. This can include inflated or fabricated medical bills. For example, a provider may bill for a more expensive service than the one you actually received. This is known as upcoding. Another example is billing for an appointment, say a test or a medical procedure that never happened. Fraud may also involve workers' compensation, medical scams, or stage or made-up injuries. So these types of fraud affect all of us. They can increase costs and misuse of personal information and leave consumers with unpaid medical bills. These examples show us why it is important to recognize the tactics that may be used to mislead consumers. Next slide. Okay, so one area to be careful with is healthcare sharing ministries. So healthcare sharing ministries are generally nonprofit organizations whose members contribute money each month to help one another's medical expenses. However, these programs are not like the same as traditional health insurance, and payment of your medical bills may not always be guaranteed. For example, you may go to the hospital believing that your expenses will be covered. Later, you'll learn that the organization will not pay the claim, leaving you responsible for that bill. So before purchasing any health coverage, make sure you understand exactly what you are buying. Ask questions. Don't be shy to ask questions. Ask, is this actual health insurance? Which services are covered? Are there exclusions or limitations? Is payment or my medical bills payment guaranteed? And request the answers in writing and take your time to review them. You can also visit the California Department of Insurance website to verify whether an insurance company or agent is licensed. If you cannot verify the license or something just doesn't feel right, stop before providing payment or providing any personal information. And so this brings us to another important point, being your own healthcare advocate. Next slide. Excuse me. So being your own healthcare advocate means asking questions until, you're going to hear me repeat, asking questions because it's important to ask questions. So ask questions until you fully understand your coverage, your treatment, and medical bills. Ask for important information in writing and keep copies of your medical bills, your receipts, insurance documents, and other communications. I personally like to take pictures because, I tend to misplace things. So taking pictures of documents, that works for me. It is also a good idea to keep record of important conversations. Write down the day and time of a call. If you can, the telephone number that you called and the name of the representative that you spoke to. Some organizations, they keep track of their calls. So these details may help them locate a conversation if you need to follow up or dispute something later. Next slide. You should also review explanation of benefits. Okay, so sometimes called EOB. Look for services, appointments, or medical equipment that you did not receive. For example, if your EOB or your explanation of benefits shows that you received physical therapy or a medical test on a day when you did not have a doctor appointment, contact your insurance company. It could be a simple mistake, but it could also be a sign of fraud. Also, for important appointments, consider bringing a trusted family member or friend. They can help you listen and take notes, remember important details, and ask questions you may not think of asking at the time. So in the past, this has worked for me because when I get nervous, I sometimes tend to forget to ask questions or note things down. So having that second person has helped. And finally, never feel rushed when making an important healthcare decision. Ask questions, request the information in writing, and give yourself time to understand your options before agreeing to anything. A legitimate representative should give you time to review the information and ask questions. Next slide, please. Protecting your personal information is important, a part of preventing fraud. Never give your Medicare number, never share your insurance information, your social security number, or your financial information to an unsolicited caller. Be cautious of unexpected calls, texts, emails, or social media messages offering free medical services. Things like genetic testing or offering free medical equipment. For example, someone may call you and offer you, let's say, a knee brace. They may then ask for your Medicare or your insurance information. Even if the person calling seems to be polite and already have some of your basic information, that doesn't mean that the call is legitimate. If you are unsure who is contacting you, hang up. Look up the official telephone number for the organization they claim to represent, whether it is your insurance company, Medicare, or Medi-Cal provider, and call that number directly. Do not call the number provided in a suspicious text, email, or voicemail. Using that official number helps ensure that you are speaking with the correct organization. Next slide. There are also simple ways to protect your information inside your home. Shred old insurance documents, medical bills before throwing them away. Remove or completely black out personal information on prescription labels before disposing of the empty medication bottles. Keep in mind that people may go through your trash looking for your personal information. If an insurance card is lost or stolen, report it to your insurance company as soon as possible. You should also report any suspected identity theft or unauthorized use of your insurance information. Next slide. Now let's take a look at a few warning signs that may indicate a health insurance scam. Be cautious of medical plans that sound too good to be true, especially plans promising extensive coverage at an unusually low price. Another warning sign is an unsolicited offer for health coverage. A professional sounding call or a legitimate looking email or social media advertisement does not automatically mean that the plan or the person selling it is legitimate. Scammers are becoming more tech savvy. They can easily copy an organization's logo and branding and even manipulate caller ID to appear legitimate. So be careful with that. Scammers may also use urgency or fear to pressure you into making immediate decisions. They may say or tell you things that the offer is only available today, that your current coverage is about to end, or that you will lose your benefit coverage if you don't act immediately. Those statements are meant to make you react before you have the time to ask questions and verify information. Remember, you have the right to slow down, ask questions, and review the information before making any decisions. If someone will not give you the time to verify the plan, then that's a warning sign. Next slide. So recognizing the warning signs is important, but it is also helpful to understand what legitimate health insurers can and cannot consider when determining your premium. So let's briefly review the rules for individuals and small group plans in California. For individual and small group plans, health insurers may consider your age, the number of family members or dependents being covered, and where you live, such as your zip code or your country. However, they cannot deny you coverage or charge you more because of your medical history, your current health status, genetic information, or pre-existing condition. In California, they also cannot increase your premium because you smoke or use tobacco. These consumer protections help make sure that people can obtain health insurance for regardless of their current past or medical condition. Next slide, please. So as I close, I want to leave you with 3 simple words: stop, verify, and protect. If something doesn't feel right, trust your gut, trust your instincts, ask questions, verify information before sharing personal information or making any type of payment. If you suspect fraud, contact the California Department at our 1-800 number. It's 1-800-927-4357. Or visit our website at insurance.ca.gov. So that concludes my portion of today's presentation. Again, thank you for your time. And now I'm going to turn it back to Sharon.
Thanks, Judy. That was great information. For our final presentation, we're going to actually turn it over to the team that helps Californians resolve these issues directly. I'd like to introduce Lori Tran, our Bureau Chief within CDI's Consumer Services Division. Lori brings a deep expertise in consumer complaints, claims adjusting, auditing, and insurer compliance. She began her career with CDI in 2006 and became Bureau Chief in 2020. So Lori, please go ahead.
Thank you so much. Thank you for the introduction. Thank you to previous presenters ahead of me. Great information. I'm here as a representative of the Consumer Services Division to go over what to do when you run into an issue. Where do you go? Who do you contact? Here in the Consumer Services Division, we're broken up into 4 different bureaus, which I'll get into later. I work for the Health Claims Services Bureau, so I'll go over what to do whenever you are running into health claims issues. Next slide, please. This next slide is just an overview of the topics that we're going to discuss. I'm going to go over quite a bit of information, and if you need to find exactly where and what information I went over, this page is referenced so that you can jump right to that information. Next slide. The first topic that I want to discuss is types of health insurance. Stesha went over it in quite a bit of detail, so I'm not going to rehash what she went over, but just to say that there are various types of health care coverage in California. We have health insurance, we have HMOs, we have self-funded employer plans and public programs like Medicare and Medi-Cal. Jurisdiction for each type of coverage follows its own rules and is regulated by different government agencies that can help with questions or complaints. We're going to provide you with a link to a page on our public website that gives you an overview of the healthcare coverage in California and the different agencies that regulate it and how you can contact them. All this to say that the California Department of Insurance, the CDI, we regulate health insurance issued by CDI licensed insurance companies here in California. Next slide, please. So finding the right agency. There's a couple different ways you can find out who regulates your type of health coverage. You can check your documents, such as your policy or your evidence of coverage, your certificate of coverage. You should be issued those if you purchased your plan, or you can, if it's an employer plan, you can go to your HR department and find it. You may even be able to find it on online portals if you log into your account with your company. You can also review denial letters and explanation of benefits, anything claims related that the insurance company may have sent to you. Those should have the additional, it should have a lot of, those should have a lot of information for you, including who the full name of your insurance company or your health plan, and also who regulates them. You can check your ID card. For example, in California, there's Kaiser Permanente Insurance Company and Kaiser Permanente Health Plan. They are two different companies regulated by two different agencies, but that's one clue that you can, use to determine whether or not which agency to go to. Of course, you can always visit our website for more information or to file a complaint. We've given you this phone number a few times now, but I'll just say it again. It's 1-800-927-HELP. That goes to our hotline. And you can speak with the CDI representative over the phone who can help answer questions or help you figure out what agency to go to. If the CDI does not regulate your coverage, we will refer you to the proper agency. So if you're not sure and you come to us with your complaint, we will find out for you. If it is ours, we'll take it, we'll handle it. If it's not regulated by us, we will find out who does, and we will provide you with that information. Next slide, please. So what are the type of claims disputes that we typically see? This is not all encompassing. This is just a sampling of the most common ones we will see. We'll see claim denials, such as benefit coverage issues. Maybe there's a policy exclusion that doesn't cover a certain treatment that your doctor is prescribing to you. We see drug formulary issues where prescription drugs in certain tiers are, may be on a formulary, maybe not be on a formulary. We see medical necessity or experimental and investigation denials from an insurance company. We also see prior authorization issues and delays. Your doctor is sending in a request to have a certain procedure done and you're not getting a response, or you got a response and you and your doctor disagree with it. Those are the type of typical claim denials that we will see. We also see other claims issues, such as delays in processing claims. You or your doctor may have submitted a claim and it's been, over a month, and you want to know what's going on with it. Why is it taking so long? We also see cost sharing disputes, how much you pay out of pocket. That includes things like your co-pays, your co-insurance, your deductibles, your out-of-pocket accumulations, how much you have to pay before the insurance company kicks in. Maybe you have a question about that. Maybe you're disputing it. Maybe it's too much, or maybe it's classified differently. You are questioning how much you're paying out of pocket. We go ahead and investigate those types of disputes as well. We also see things like non-covered amounts. If you're going out of network, maybe the insurance company is only allowing a certain amount of your claim and you're being stuck balance billed for the remainder of that. And the insurance company is saying it's not covered. It's, that's something that we would take a look at. Things involving the maximum allowed amounts that the insurance companies are paying. Network access. I know Stesha and Gabriel went over that earlier about your right to timely access to care. So we review those type of disputes as well. If you're not able to find a specialist that's in network, or maybe the in-network physicians that are available are not booking for months on out, you're not getting that timely access to care. Those are type of issues that we will absolutely investigate and take a look at. And again, balance billing, if you are receiving a bill from a provider because your insurance company didn't pay all or part of it, and now the provider is coming after you, those are balance billing issues that we will take a look at as well if you come to us and file a complaint. Next slide, please. So language access, again, this was something that Gabrielle went over in her presentation, so I won't belabor it. But just real quickly, insurers must provide a qualified interpreter when you ask, either in person or through a telephone or video conferencing system. State law requires that hospitals have interpreters, either on site or by telephone 24 hours a day, and the health insurers must pay for these services. So if you're running into issues with language access and the insurance company is not providing these services or not paying for these services, definitely notify us so that we can take a look into it. Insurers must provide written materials on the main languages spoken by their members. These materials can include your handbook of benefits, called the evidence of coverage or your policy, standard letters and notices, letters of denial, reduction, modification, or termination of services and benefits, and notices to your right to file a grievance and appeals. So again, if you are running into language access issues, please file a complaint with us so that we can take a look at it and ensure that you get what you're owed in due. Next slide, please. So you have an issue with your claim. What do you do now? The first step is to explore your internal grievances and appeals process. You will need to file an internal appeal or grievance with your health insurance company. That can be done over the phone, in writing, or online. Your denial letters and EOBs should have appeals and grievances instructions. I just got a denial myself in the mail yesterday. It's 15 pages long. It's a lot of information. But in that denial letter, it tells me the reason why they're denying it, their justification for denying it. And it also tells me who I can contact if I disagree, what steps I need to take internally and externally. So even though it's 15 pages long, it does have a lot of useful information. So always make sure that you're reviewing those documents that you're getting from the insurance company, because they're required to provide this information to you. Your policy documents, like your evidence of coverage, should also have sections in there that detail the appeals and grievance process. Generally, the insurer has decision timelines, and it's for any urgent or expedited appeal or grievance, they should be responding within 72 hours. If it's non-urgent, they do have 30 days. You can contact the CDI if you disagree with the appeal and grievance decision. If your case is urgent and insurance company is just not providing a response, and you have not received a response within the specified timeframes mentioned above, please contact us and we can take a look and see if there's anything we can do. Main thing is don't delay. I know that it's probably the last thing on your mind, especially if you're going through a serious medical incident. You're not wanting to think and deal with insurance, but just keep in mind that you typically have 6 months from the denial date to file an appeal. So don't let it go on for too long without filing the necessary appeals to make sure that you get your timelines met. Next slide, please. So you've gone through the internal appeals. You're not happy with the response that the insurance company is giving to you. Maybe they're not responding at all and it's taking too long. What do? You can file a complaint with us. There's two types of complaints that we generally take a look at. One is the request for assistance, and one is called the independent medical review. The request for assistance, that's one where we take a look at things like benefit coverage decisions, exclusions and policy limits, anything non-medical like delays or out-of-pocket costs or network adequacy issues, payment, billing, coding disputes. We handle that through our RFA or request for assistance process. And that goes for consumers or providers. If your doctor wants to file the complaint on your behalf, they can come to us. Or maybe your doctor or maybe you are a doctor and you have a group of patients where you're having an issue and you want to file a complaint on that, on all those cases. We have a provider complaint process as well online. The second type of complaint that we take a look at, that we handle, is called an independent medical review, or an IMR. And a consumer or the healthcare provider can file that with us. Those are disputed healthcare services. So those are things like medical necessity or experimental investigational denials. Those are things like prescription drug denials. In California, if you are prescribed a drug and it is medically necessary, the insurance company should cover it. So if they're not covering it, it must be because they don't determine it to be medically necessary. So we take a look at those under the IMR program as well. Things like cosmetic denials. If your insurance company denies your claim stating that they believe the services or the surgery is cosmetic in nature, but you and your doctor disagree and feel like, no, this was medically necessary to treat a medical condition. Those are certain things that those are the types of complaints that we would review under our IMR program. Emergent versus non-emergent care. So if your claim is, a part of emergency care, there are additional benefits that may be available to you. So if there's a dispute on whether or not your care was emergency care or not, we would use the IMR program to determine that. We get this sometimes when somebody goes, for example, to the emergency room because they're experiencing heart pain. And maybe it turned out to be something that wasn't life-threatening. Maybe it was severe heartburn. But the insurance company is denying the claim, or not denying the claim, but maybe they're paying the claim at a lower rate because they feel like, well, that was not an emergency. So you don't get to access your emergency care benefits. We're just going to consider this a non-emergent claim. That type of dispute would qualify for an independent medical review because that requires medical expertise to review and resolve. If a prudent layperson felt that this was an emergency, it should be considered an emergency. So those are the types of issues that we will qualify for our IMR program. If we receive a complaint and it turns out, say you're requesting an IMR and it doesn't qualify for an IMR, don't worry about it. We will still review the case as an RFA complaint or a request for assistance complaint. So either way, however you come to us with your dispute, we will take a look at it and we will see it to the end. Next slide, please. So where do you go to file the complaint, or where do you go to get in contact with us? On our webpage, there is right on the very front, it's right there where you can see it says file a complaint. Just click on that. It'll take you to the page. Whether you're a consumer, patient, or if you're a healthcare provider, there's different portals there for you to file your claim, to file your complaints online with us. If you would rather print out the forms and do it manually, there are printable complaint form links down there as well that you can click on and print and mail it in to us to handle. Our phone number also is there for our hotline, 800-927-HELP, HELP 4357. That is to our hotline for if you need to speak to somebody over the phone right away, that's available to you as well. Next slide. So the next two slides, I'm just going to kind of give a quick overview of the two complaints that we handle that I went over with you earlier. The request for assistance, or RFA process, is the first one. So what happens? You file the complaint with us. What does the department do with it from there? Once you file the complaint, the first thing we do is we verify jurisdiction. Because if it's not our jurisdiction, if we don't have authority over the complaint and over the issue, we want to make sure that we get you to where you need to be as quickly as possible. So that's the first thing we do. We verify jurisdiction. If it is within our authority, we'll open the case. If it's not, we'll let you know where you need to go for help. Once we do open the case, we send an acknowledgement letter to you. And then we also notify the insurance company and provide them with a copy of your complaint and ask them to respond. The insurance company will review and respond to both you and the department, and they'll send us a copy of the entire claim file so that we can take a look at it and review. When we do the review, we review the file for compliance. So we review that it complies with not only California insurance laws, but also the terms of your policy. We determine if the insurance company's response is appropriate. Did they answer all the questions that we had? Was it a complete response to your complaints? And if all of that is said and done, we will notify you, the complainant, once the review is complete, whether it's unfavorable or favorable. Hopefully it's favorable. We will notify you at the end with the results of our complaint handling process. Next slide, please. Now, the other type of complaint file that we handle, the IMR, or the independent medical review, it's a little bit different. With this one, when you file an IMR request with us, we'd still go through and verify jurisdiction and refer it out as needed. We also check to see if the case qualifies for an IMR. Was the internal appeal filed already with the insurance company? Were the necessary timeframes met? Does the type of dispute qualify? Again, if you file a request for an independent medical review with us and it doesn't qualify, say it's a copay issue, we will just convert the case into an RFA case like before and handle it that way. But if your case does qualify for an independent medical review, we will send the packet, your entire packet and everything that we've received, to our IMR organization. And the IMR organization is Maximus Federal Services, and they employ and contract out to medical professionals that will review the case. So doctors specialize in the field in question. The insurance company will send their entire claim file to the IMR organization, and you are notified at every step of the way. Depending on the type of case it is, the IMR will review the file. It could be anywhere from 1 to 3 doctors reviewing the file based on the type of the denial. The decision could take anywhere from 3 to 30 days for the decision based on the severity of the case. If it's an urgent case, obviously that has a quicker timeline. The final determination will be sent to us here at the CDI, to you, and to the insurance company. So everybody will be notified of the decision of the panel of reviewers. The CDI will adopt the decision once we receive notification. The decision is final and binding, so the insurance company can't appeal or dispute it. Once we adopt the decision of the IMRO, letters will be sent out to everyone involved to notify them of the decision. If it was overturned, the insurance company will send out the authorization and payment. So, and we monitor that to make sure that they do that as well. Next slide, please. So this is just a breakdown of Consumer Services Division here at the CDI. It's broken up into 4 different bureaus. I'm in one of those bureaus. I'm the Bureau Chief of Health Claims Bureau. But we do have 3 other bureaus that can handle any type of insurance question or dispute that you may have. We have our Consumer Communications Bureau. That's our hotline. So they will handle all lines of insurance, general inquiries, either by phone or email. I'm in the Health Claims Bureau. We deal with written complaints dealing with life and health insurance. But that's not all that we do here. If you have issues regarding cancellations or rate regulation or rates, underwriting issues, we have a whole department, Rating and Underwriting Services Bureau, that handles that. And then we also have our Claim Services Bureau. They handle written complaints regarding property and casualty insurance, so homeowners insurance, auto insurance, things like that. So that's just kind of a quick snapshot overview of the Consumer Services Division. We handle more than just health claims disputes. But if you have any information, next slide, please. The next slide is going to be our contact information, where you can reach us either online, on the phone, or by mail if you prefer. And these links and information will be provided to you separately as well, so that you can access them easily. Thank you all so much for allowing me to present this information, and I'll hand it back to Sharon.
Thank you, Lori. That was great. I know this whole webinar was a lot of information, but I think if there's some key takeaways, it's to know that California law gives you a lot of strong consumer protections. And so it's important to know your rights and also don't hesitate to use them. And as always, we have our contact information there. The California Department of Insurance is here to help. We're available for that. And whether that's through, the Health Equity and Access Office, our fraud division, our consumer services team, everyone here is under the same goal of consumer protection. So go ahead and change slides. We'll just wrap this up. Just wanted to plug our next webinar. Just keep an eye out for this upcoming webinar in this series. The next one is going to be about business insurance on October 21st at 6 p.m. And then at the end of this webinar, we'd really appreciate it if you could take a few minutes to complete our post-webinar survey. The feedback really directly covers or directly shapes what we're going to cover next. And then next slide, please. And then just before I let you go, just one more thing. If you haven't had your fill of insurance in California, today we also have another webinar at 5 p.m. The insurance commissioner, Ricardo Lara, is going to be on, as well as Carolyn Kuski from Insurance for Good and Amy Buck, and they'll be giving an update of the homeowners insurance market in California. Just a lot of really great insight. So please do tune in for that. And then the next slide, I believe, is just our last final contact slide. Just want to thank everyone for joining us today. Thanks again for all of our presenters, Sasha, Gabrielle, Judy, Lori. This concludes our session. Have a great rest of your day. And again, here's our contact information and our social media platforms. But thank you so much for attending the session.